Welcome to this newest edition here of the Adventist Health Wellness Connection. I'm Kiyoshi Tomono. We have taken the show on the road. We are on location here at PT Solutions, a partnership with a local PT Solutions company. And this location's here at Truxton and Oak. So it's centrally located in Bakersfield. And joining us here this afternoon, Leanne Forey, who is the Senior Clinic Director, PT Solutions. Good afternoon. Thanks for joining us.
Thanks for having me.
Good to see you. And Danya Warden, who is a physical therapist here.
Hi.
Good to see you as well. So today we're going to be talking a little bit about what PT Solutions does here in our community, what kind of services they offer in terms of rehabilitation, and that really kind of spans the globe from younger kids all the way up to athletes and weekend warriors like myself who try and do too many things at once too early. So if you have a question that you'd like answered regarding physical therapy and how you can kind of keep yourself healthy and well and doing those activities you love, go ahead and ask it here on the 23ABC Facebook page, and we'll try and answer them as we go along. So, Leanne, thanks so much for joining us today. So let's talk a little bit about kind of the topics from sports injuries to everything else. What kind of services do you guys offer here at PT Solutions?
Yeah, so we just opened this clinic April 6th, so we're still pretty new and just assessing the needs of the community. Right now we have multiple physical therapists at this location, and we're doing like outpatient physical therapy for all like surgical procedures and conservative care for elbows, knees, backs, all those kinds of things, and like return to sport. So we're doing a lot of COVID recovery too, strength and conditioning, especially through the period of COVID where everybody kind of fell out of shape, and lots of falls and balance assessments.
We'll take them all.
We'll take everything.
We'll take them all.
Yeah, so Don, talk to me a little bit about what physical therapy is. Maybe we go back and even start with that. Like if I was referred by a doctor, I need to go physical therapy. What is physical therapy?
Yeah, that's a great question. We really work with you on whatever your impairments are and what your needs are. We're here to help if you have something wrong with your muscles, or you have something wrong with your joints, you have something wrong with your endurance, your conditioning. We kind of get you, your nerves, we kind of get you back into the swing of things. We'll get you a good exercise program. We'll work to kind of calm those muscles down, calm those nerves down, and get you back into the shape that you want to be in.
So Leanne, how do you know if you need physical therapy, right?
Well, a lot of times if you have burning, numbness, tingling, those are abnormal symptoms. If you're having them consistently, not like, hey, I slept wrong, my arm's a little numb, and then you get up and go. If it's something more consistent, or it's bothering your quality of life, if you have any bowel or bladder dysfunction, you'd be worried about some kind of spinal cord injury. If you had any family history of cancer and those kind of things, all the red flags, you would want to be checked out for something else, but also like just physical therapy in general. If you're having like sharp pain with movements, or you're having trouble sleeping, or doing the things that you usually do, or they become painful, that's definitely something you would want to, get checked out by primary care or your ortho, and then, potentially rehab if it's a musculoskeletal or
nerve issue. I think
I think you hit it really well with saying quality of life. Like if your quality of life changes, you're not able to do the things that you enjoy doing, or just even your everyday things, and that's a sign that you can come here and we can help you out with it.
So let's talk about that. We're in this beautiful kind of state-of-the-art brand new facility, again off of Oak and Truxton here in central Bakersfield. What happens, I know we kind of blocked a little bit of this with our signs, but behind us there's a bunch of tables. It almost kind of looks like a gym. There's workout equipment right next to us here, right off camera. What happens when you come into physical therapy?
Yeah, well, we call it a gym. This is the gym. We're like, yeah, come on back. We usually we'll do some manual therapy on you first if that's indicated, which kind of deals with, like I said earlier, calming down your muscles or working on your nerves a little bit. And then we've got an exercise program usually planned out, and we add on things as people come in for different sessions. So then we use all the wonderful equipment that we have here and try to be creative and come up with things for people to do that mimic your everyday life, or also just in general to help you get stronger, work on your range of motion, anything like that.
Yeah, because I'm speaking from my personal experience. I'm not violating HIPAA, so I can talk about my own personal experience. But I had some hip issues just recently because I run, probably just an overuse issue. And like the first thing you come in is kind of measure the range of motion, right? So you kind of know the baseline of where somebody's starting versus where they should be, right? So talk to me a little about that, Luann. You're looking at somebody, it's like you should be able to go move your joint 30 degrees versus you're only at 15, right?
Yes. Well, everything's connected. So usually if you have a hip issue, you want to make sure you look at thoracic spine, low back, hip, knee. You want to look at all of what's connected. You want to check nerve conductivity, how are my reflexes normal, range of motion in all those areas, symmetrical, side to side, and then within like a good range. Are you able to push off adequately? Do you have the flexibility you need in certain muscles? And then just like the strength and power and technique, you want to see all of those elements. So everything is very personalized to one person. We would never do cut and paste the same thing, with different people, because everyone needs different things. So baseline is just getting a feel for what all the impairments are and how they work together with what is going on with you. And then, time to time with the team, we will just communicate with each other like, hey, he's coming in, this is what we found last time, this is what we're working on, and this is our end game, so that's where we're going.
I mean, it literally, I'm just, again, speaking from my personal experience, it was like stretches first to get you kind of prepared, but it was a workout, right? And when you and I were talking, it was about kind of building up your other muscles, because sometimes the reason why you're injured is because the other muscles that you're supposed to have built up are not where they need to be, and so you overuse that thing, right?
Yeah, especially when we don't do like some cross training in some individuals, and you really like to do one thing, your body can get used to one thing, and like some of the other ones aren't activated as much, and can really create like sort of an overuse issue at times.
Yeah, and the interesting thing is, I'm kind of talking about the athlete, which I do want to keep talking about a little bit, but you see a wide spectrum of folks here. You've got somebody who has injured their foot, injured their knee from running, walking. You've got people who injured it at work. And then you have folks who are also kind of, just disabled and don't have the ability of the range of motion. So you have kind of a full spectrum of people that are all working through different things, right?
Yes.
So how do you get those folks who are, let's say they injured themselves or they have a back injury, how did they get back? Because they're not looking to maybe run a marathon, they're looking to just get out of bed and not feel pain, right?
Yeah, everything's really specific. So somebody who's had low back pain for 20 years, their goal might just be to walk to the mailbox and back. So you definitely want to gear up to what the person needs. Somebody who's had more of a chronic issue, you want to make sure you address like, certain elements that will return you to function in terms of like progressive loading. If somebody is like highly irritable pain, you want to make sure you address elements to decrease the threshold irritability. So really it just depends on where they're at for each injury or what's going on with them and where their end game is and where they are in the irritability spectrum and how much we can like functionally load, and we figure that out over time to sort of like gear up the best and help them the quickest.
Yeah, we really try to look at the patient as a whole. So yes, like you do come in with an injury or some kind of imbalance or deconditioning, but we want to work on what you want to work on so that you're able to get back to walking down to your mailbox or running a marathon. Either way, it doesn't matter to us. Like, we're looking at you big picture to make sure that we can help you in the best way possible.
So let's talk about athletes and overuse, injuries and things like that. So how, if you're an athlete, what are they looking for when they come back here? Is it strength and conditioning too for them?
It depends. Sometimes, like say a baseball player, an overhead athlete, they might get some sort of impingement syndrome in their shoulder, or like a torsion injury in their back or knee. So it depends if they're coming in more for like an injury, current injury, or an injury prevention program. So if we're looking for an injury prevention program, what they would come into physical therapy, and we could kind of assess like where they're at. And there is inherent abnormalities with like an overhead throwing athlete, let's say, like they have way more external rotation than internal. So you factor that in, it's not going to be symmetrical. We know that. Just factoring in the strength that you would need for your sport. Do you have the acceleration, deceleration? Do you have the right strength, the right like muscle activation patterns?
Right, movement patterns.
Right, yeah. And so we take that all into account and make sure we train towards that long term. So even if they weren't here consistently and we just got a great prevention program, and you would start probably before season and all during season, so it doesn't drop off like when you start training, and that all falls by the wayside. So just making sure they have a strong, healthy athlete along with all the sport specific things that they do in training.
What kind of things do you see most student athletes come in with, especially football? I mean, baseball, is it shoulder issues in baseball? Is there a specific thing, or is it just all over the board?
Shoulders a lot with baseball, like overhead. And you have like the throwing athletes, knees, and like
hips
hamstring.
For girl runners, like female runners, hip injuries,
for soccer
knee injuries.
players.
Yeah. A lot of ACL. Rehab, either it's conservative or post-surgical. For a lot of, women soccer players are just like the most often in type of athlete to injure, like their ACL or meniscus. in the knee. So that's what we commonly see.
Okay, and so like myself, a weekend warrior, not a professional athlete, student athlete, how do you know when you need to come in for physical therapy? When is the point where it's just beyond, like, oh, you know, I always kind of hurt a little bit after running because I'm old, but how do you know, like, that's where it goes from being normal to, hey, I need to probably go see a physical therapist?
I think when you notice that it becomes, maybe, hopefully it doesn't get quite to that point, but when it starts to become debilitating, where like you feel like you can no longer lift the same weights that you were lifting before, or participate for the same amount of time that you were before, or that you need to take more breaks, even like things like that, where it starts to deteriorate, is when you notice that something else deeper is probably going on, and then you might need to get an appointment scheduled.
Or again, any like sharp pain, numbness, tingling, burning, like anything that is not traditional, just like, hey,
pain that wasn't there before.
Like anything that wasn't just like, hey, I'm a little sore from working out, or a little stiff, or I pushed a little more distance and I'm a little achy. Anything more than that, you know, you may want to consider. You know,
or if you're sore, like soreness 2 days post workouts is pretty normal. But beyond that is kind of where we start to get more concerned. That's kind of where we also look in our sessions too. We always ask when people come in, like, how did you respond last session? Were you really sore? Were you sore for days? Were you sore for 1 day? Because that gives us an idea of, did we push it? Did we do too much? Or did we do enough? Was it good? How can we like change it from there? So then if you're noticing that you're staying super sore for a long time, then that's probably not a good thing.
So functionally, for that person that's got back pain, I mean, is there stuff that they should be doing at home as well? I know it's kind of a home program, but you're trying to build up strength overall, right? So that it becomes a daily part of their life, right?
A big part of physical therapy is you doing things at home, actually. We give you the foundation here, and we work on you as best as we can, and we give you all of the components for it, but then it's also up to the patients too to continue it on when they get home as well.
Along with that, you know, chronic low back pain, we know from research that it's probably going to creep up every now and again in your life. Like over years, there might be a flare up, like, you know, throughout your life. And we know that's like a typical pattern. And so a huge component that we also want to address is, when this happens, what do you do? What is your easing factors? What is your aggravating factors? Do you have good self-awareness? Do you know how to manage? Are you like fully independent? So we know that's likely in the future. You might pull something, push something, move some furniture, you know, really get aggressive with your cleaning routine one day, or whatever the case may be. And the important thing is, don't have a heart attack, you know, don't have high fear index for movements. You just have to realize what is helpful, what's not helpful, when am I pushing it. Just like really great like self-awareness, and that's what we try and teach too as they discharge out of our program. So of course we're always here for anybody who needs us, but also trying to teach them the skills to be independent.
That's me, right? Is back when I was younger, I could, you know, claim a soccer injury or something like that. Now I'm like, I cleaned too much, or I got out of bed too fast, and now my back hurts.
Like, oh.
Those are adult aching hurts, right? And that's true. I mean, I also, it's better now, but I did have a back injury for the first time like a year ago in the middle of COVID. I was picking up my kid, doing the whole, you're supposed to not twist and bend at the same time with your kids, and threw up my back for the first time. And it's a pretty, it is a life-changing pain, because every time you move, you're aware of the fact that you've injured your back. So for these patients, right, and is part of the goal too for those patients to potentially be able to wean them off some of the medications and everything else so they can get back to those full functionality?
Yes.
Yeah.
We definitely don't want somebody to get like kind of stuck in the medical system in terms of like procedures and x-rays and MRIs and medication and my chronic pain management doctor, you know, all of the plethora. So the quicker somebody comes in, there's a lot of research that the quicker they come in right after an injury, the quicker that we can sort of recover and try prevent it going into like the chronic phase.
Keep them in recovery.
Right. So the quicker we get these patients, quicker we can work on independent management. Things haven't adjusted quite as much in terms of like muscle strength and length and like stiffness and hypermobility. So the quicker that we can tackle that, the more likely are we to keep them away from like that whole like medical plethora of sequelae of events that comes when you've just been in chronic pain.
Yeah, and one thing I found myself too is compensating, right? You wind up like starting favoring the other side in order to like so you're not in pain all the time, which leads to more problems, right? So how do you get in quick? Speaking of that, can anyone just call and make an appointment? How does it work to get into physical therapy? Do you need a doctor's referral? How does it work in California?
Yeah, you can do both actually. So as doctors of physical therapy, we are able in California to take you on as direct access. We can see you for 45 days or up to 12 visits, whichever comes first. But then after that, we do need you to go see a physician and get a referral, or you can be referred by your primary care, your podiatrist, anyone that's where your injury was coming from, then they can write a referral and send you over, and then we'll actually give you a call once we get the referral from them and get you set up with an appointment.
Yeah, so California, we are allowed to do direct access. This direct facility, we do have a referral, but what we could also do is have somebody just come in and we can screen somebody like, is this musculoskeletal, is this orthopedic, is this something that we should be seeing, or is this, hey, a red flag, or somebody we need to help and refer to a more appropriate location, and so we'll kind of work with that. And then in terms of like once you have a referral, your doctor said, hey, I want you to come to physical therapy, we get faxed all our referrals. And if your doctor has a different mode, like gives you a script sheet, you can call the number, go to the website, our phone number that we'll mention at the end. You can text it, it goes straight to our computer, so we can set up appointments that way. So just multimodal, there's plenty of ways you could get a hold of us. You can stop by.
We're very accessible.
Yeah.
So I'll give the number now, 661-637-8397 or ptsolutions.com. We'll mention it again at the very end. So you mentioned, though, you can get 45 days of or 12 sessions or visits in first before you actually need to go see a primary care physician.
Yep.
But it sounds like you guys work pretty hand in glove with primary care, with orthopedic doctors, because it's like a treatment plan, right?
Right. So
yeah, we're all part of the team that works with the patient to cover all the bases of everything. They can see our documentation and they know what's going on with their patient just as much as we know what's going on with their patient too.
Especially with our, strong Adventist Health partners, we can Teams most of our physicians, just like, hey, that you're going to see this patient tomorrow. We had a session today. This is where we're at. So it's really great lines of communication, and that really helps with the continuum of care and making sure they get what they need when they need.
Yeah. Like for post-op if there's any restrictions, then we know like where the patient can be week 1, 2, 3, where they need to be moving onto with week 6, things like that. We can be in direct communication with them.
So how long is a typical session? I don't know if my session was normal. It was about 45 minutes to an hour. Is that typical, or sometimes longer or shorter? And how many sessions do you need?
Yeah, it really does depend. It's about 45 minutes, but if somebody needs a few extra things that we really wanted to achieve that day, it'll be longer. Or if somebody is new to a conditioning program or deconditioned or has poor cardiovascular endurance in the beginning, it might be a little bit shorter as we build up tolerance. We don't want to go like so hard and fast if that's not something you're used to, so definitely patient specific. And so at the beginning, everyone's different, and we also want to take into consideration any insurance limitations they might have, and just really work with the person, what they have, what's going on, like all the factors involved. But what is most research driven is higher frequency in the beginning, 2 to 3 times a week depending, and then as they become more independent, there's more carryover, starting to have decreased irritability of symptoms, we'll move to like twice a week, once a week, and then space it out until we've reached their goals, and together we feel like, okay, we're good. You don't need a program that is consistent anymore, and then we'll kind of move to a home program.
And you do that by kind of doing an assessment, right?
Yeah, we're constantly checking progress too, taking measurements and asking you how you are, and comparing to what we did last session and how you're doing in your everyday life too. So we're always updated on what's happening so that we can continue to make that plan of, do we need all of these sessions? Can we already drop down a little bit? Do we need more sessions? So it fluctuates.
And for some people, it's range of motion. Other people, it's being able to stand on their own and feel stable and not feel like they're going to fall. It just depends on the person.
Yeah.
Yep.
So let's talk about, you mentioned, Leanne, at the very beginning, folks who have been kind of at home, working from home during the pandemic, haven't been out as active, probably may have cut back. Some folks have on their activity. What should they be doing? Any tips for those folks?
Yeah. This is so common now, and everybody's like working from home now, so not even getting the exercise to and from their car or up and down the stairs of their building. Sometimes you like roll up in your pajamas and change clothes, and then you're ready for work. And so we're seeing a lot of this, people who have sort of been out of the game or got out of their gym membership or stopped exercising, and now, having a little bit more like functional difficulty. And so at least for some tips for people who are sitting a lot and been like at home and work from home, a lot of computer work that we have, a lot of like the pecs get really tight and like forward head. Yes, and so, I mean, you know, like a busy work day, just like over time, if we don't have the endurance of some of these muscles. So a lot of people are coming in with neck and shoulder pain. So, you know, we definitely would want to work on pec, you know, like extensibility, and that's something we can talk about. And if somebody comes in for a screen, we could help them with this. But a good ergonomic assessment would be a great tip, and there's plenty of tips online, and we could also help with that. And then a lot of like low back pain from just prolonged sitting, and so working on like mobility drills where you're working on like mobility of your spine as you're sitting. And then the hip flexors also get really, really tight from prolonged sitting, and so there's some hip flexor stretchers that, you know, you could kind of look up online, or that's something we could help you with if you come in and you're just like, hey, I've just been sitting 12 hours a day for the last 2 years, like, you know, I'm not, you know, how do I prevent this? We could kind of talk about some of those things.
Even just going for a short walk, like, and any breaks that people have, or just stand, if they are able to have a standing desk, or like sitting to standing at random times, just to like break up having to sit for 12 hours and keep those hip flexors from feeling super tight, then that's something that we try to educate them on as well.
Stretching, those kinds of things, right?
Yeah, I definitely want to recommend like every hour, you know, maybe 50 minutes, a 10-minute like break, like go to the bathroom, get a drink of water, go for those short walks, and so that you're not just, get up from that chair.
It seems like there's kind of two trains of thought. I mean, but COVID has really put the spotlight on well-being and kind of the lack of well-being in this country, and this idea that, you know, we're kind of refocusing. COVID gave us a chance to refocus on our what matters and what's important, and well-being seems to be one of those things. So I'm be interested to see if more people are maybe injuring themselves getting out there like I am running, or exercising too much.
Yeah, especially going from being sedentary after maybe quitting an exercise program or not being able to be part of an exercise program anymore, and then being like, well, I'll just go ahead and start it over again, but you're not at that same level anymore. So you see it both ways. You have the people who aren't moving as much and that's been their norm, or you have the people who tried too hard at the beginning and injured themselves. So
Any tips for those folks to ease back into that, right?
Yes.
I mean, you and I were talking before you even came back on camera of you know, not going out too fast too soon.
Progressive loading, yes. And so if you're not used to, like, say, a walking program, you could start at a very easy distance for you, maybe 10 minutes, and then, you know, easing into like 10-15% increase per week. So not every session you're going to be increasing. You want to get used to that level and then increase a little bit more. Get used to that level, increase a little bit more. And the same for weight training and strength training and conditioning. You would want to back off maybe even 50% of the weight that you did, high endurance, low load, and then get used to that again. Assess how it's going. If you're having any pain or discomfort, do we need to back off a little more? Do we need to alter the program? Do we need to ease back into that a little bit slower and just high reps, low load in the beginning, and then start getting back to where you're at, you know, week by week. But, you know, it takes like 9 to 12 weeks to build up 1 grade of muscle strength. So if you've been out of your program for maybe a year and a half is more of a realistic, you know, COVID timeframe, it's going to take quite a few months to get back, and so we're just seeing, you know, a lot of people being a little bit impatient and trying to get back.
Overly ambitious.
Trying to get back to where they were at very quickly, and that's just not physiologically like sound.
Right. You can't get there in a day. It's got to be kind of taken over time. Again, we're at PT Solutions, a partnership with Adventist Health. 661-637-8397 is the phone number here. PTSolutions.com is their website for more information. This location here, Truxton and Oak, which is at kind of the central area of Bakersfield. And then at some point, who knows where you guys will have other locations in Kern County.
It's doing great, and we love this partnership, and we're looking to see where we can grow and help the community.
Anything else I missed to ask?
No, I think you
covered
nailed
it.
We covered a lot today. Well, thank you guys both, Leanne and Danya, for talking today with us, and thank you for joining us here on the Adventist Health Wellness Connection. We'll see you again next time.